Many of you have heard the news story of Andrea Yates, the mother who drowned her 5 children while suffering from postpartum psychosis. Now, initially, she was convicted as a murderer, but 5 years later, she was retried and convicted as criminally insane.
That's right, and one of the defense experts in this case is our next guest today, Lucy Puryear, a medical doctor and author of this book, Understanding Your Moods When You're Expecting. And she's here with us today to tell us all about women's mental health in relation to their reproductive state. We appreciate you being here with us, Dr. Puryear, today.
Thank you for having me. Hi. Well, first of all, let's do a little background. Okay. What made you focus on this particular area of psychiatry?
Well, it's interesting because there didn't used to be this area of psychiatry. It's only been recently in the last 10 years where psychiatrists have really been interested in women's mental health. I thought I was going to be, it's hard to believe.
Honey, we've been crazy for generations.
I thought I was going to be an OBGYN, and you know, I had this fantasy that I'd get to sit by women's bedsides and deliver babies. And once I got into medical school, I saw that the obstetricians really didn't get to do the kind of care I wanted to give women. They were so busy and sleep deprived and doing surgery. At the very last minute, I did psychiatry, and it was like reading a novel every day or going to the movies, and people's stories were fascinating, and I just felt that that was a place I could be most helpful. Fortunately, there was a little luck involved. I was asked to teach the OBGYN residents about women's mental health, and it clicked that I could do both. I could take care of women and be a psychiatrist. And
you know, one of the things I often think about is you know, as women, do you find that we are more predisposed to maybe having psychiatric issues than men?
Well, not psychiatric issues in general, because both
depression
men...
for sure.
Depression,
right?
for sure. 1 in 4 women at some point in her lifetime is going to have a depressive episode. That's a huge number.
Sure is.
And that means...
Is there something about our hormones that makes us more susceptible to that?
The thought is, when you're pregnant, estrogen and progesterone levels are higher than they'll ever be at any time in your life. About 3 days after delivery, they go down like driving off a cliff. And it's thought that that sudden drop in hormones is what triggers postpartum depression in a certain group of women.
Okay, what are the symptoms?
The symptoms of postpartum depression are difficulty with appetite, difficulty concentrating, tearfulness. I think what's most important for a family to know, however, when they're wondering if their loved one is suffering from postpartum depression, if the woman is complaining of mood symptoms, being tearful, depressed, 2 weeks after the baby's born, it's no longer something called baby blues. You need to check and see if it's postpartum depression. The other thing that you need to be aware of, women with postpartum depression can't sleep, and you're anxious, and even if the baby's sleeping, you're laying down worrying about the baby, ruminating.
You've been there?
I've been there, done that. Yeah. But I think what happens is people tend to confuse postpartum depression with baby blues.
Right.
What is the difference between the two?
The biggest difference, one, is that baby blues should stop at 2 weeks after the baby's born.
And baby blues is just feeling just a little down.
Like PMS,
just
right?
like PMS.
Like pretty strong PMS.
Tearful, some irritability, crying at the drop of a hat just because the neighbor brings a casserole for no good reason.
Right.
But the mother's still able to enjoy her baby. She's still glad she had the baby. She enjoys holding it. She enjoys feeding it. Mothers with postpartum depression will talk to you about feeling no emotion for that new baby. They wonder, what have I done? And they'll often say to me, I just want to get in my car and drive away. I made a mistake. I shouldn't have had children. I'm going to be a terrible mother. So it's this feeling of detachment from the baby that is characteristic of postpartum
That's
depression.
interesting. And my symptomology included fear of being separated from the baby, that something bad would happen if I ever went out the door or went to work.
And you may have had a postpartum anxiety, which is also very common postpartum.
Mixed in there.
there.
Okay, let's talk about the most common treatments used now.
Well, I want to say first that psychotherapy is always important. And in my psychiatric practice, I either do the therapy or refer out. But if you're having a...
It's nice to hear a prescriber say that talk therapy still works.
It still works. It's very, very important. Imagine, you know, when you have a baby, everything in your life is turned upside down. You're suddenly a mother, your relationship with your partner is different, your relationship with work is different. You need to talk about all those changes in your life. But with severe depression, antidepressant therapy is imperative and works very well.
How does the baby suffer from the mom's illness?
There's lots of studies looking at the effects of maternal depression on newborns, and I can give you a good example from my own practice. I had a mom who came in with her baby, which is always fun for me. But she came in with her baby. She knew she had postpartum depression. She sat down and put the baby near my chair. And she couldn't even reach the baby. So when the baby was fussing, I was playing with it, or I asked her for a bottle. Babies don't get emotionally stimulated when their mothers have depression. They may be clean and well cared for, but there's disrupted attachment. The problem with that long term is that those children are more likely to have psychiatric illness, lower IQs, behavioral problems in school, and attachment difficulties. So not just for the mom, but for the whole family, the newborn and her other children, it needs to be treated.
Yeah, and the psychopharmaceuticals that are out there are so symptom specific that they're not like the crazy dizzying drugs from the 50s or 60s. We should tell people that this is a very mild form that helps just the depression.
These are exactly, and they have very few side effects. They're commonly the SSRIs, serotonin reuptake inhibitors, and women can breastfeed on these medications. Most pediatricians...
I did, and my kids got a really high IQ. We're good.
So some women may not want to get treatment thinking that they're not going to be able to breastfeed, but you can breastfeed on these medications.
Great.
And I know we've got to wrap up. We only have just a couple of seconds left here, but do you find that women may be a little afraid to come forward to you and talk about this issue that's affecting them?
I think two things. One, women feel enormous guilt that they're depressed because everybody else is ecstatic and happy, and they're thinking, I'm not feeling so happy. So they want to keep that to themselves. They feel terribly guilty. And then there's just the stigma of talking about depression or any other psychiatric illness. The Andrea Yates tragedy, you know, her life will never be the same, nor her children's. But that has probably changed the face of women's mental health more than anything. I now go all over the country and speak. The media pays attention. There are support groups forming. So the treatment for women is improving, and women are speaking out.
Dr. Puryear, thank you so much for being with us today. The book, again, is Understanding Your Moods When You're Expecting, a must-buy for any pregnant friend you have, okay? Don't forget. Thanks for being with us today.
Thanks for having me. Up next, have you been looking for the perfect permanent TV by your pool for your patio? Well, we have it right here. Stay tuned.